All right, good morning, everyone, and I'm Dr. Victor Politi, the President and CEO of New Health, Nassau University Medical Center on Hempstead Turnpike. I want to welcome you and thank you for tuning in to Health Talk this morning. As healthcare in America is changing, Nassau University Medical Center, New Health is part of that change. And so this half-hour program will provide you with some essential information about the services and the facilities, and that we provide top-quality care that fits into your lifestyle. Our roots go deep in Long Island history. We've been here since 1935 as a general hospital. Now we're a major medical center with delivering excellent care to everyone at every stage of life. I mean, you already know us as that big hospital on Hempstead Turnpike, that level 1 trauma center, one of the best emergency departments, God forbid something goes wrong and you need us in a hurry. But what most people don't know, that we have a full service, state-of-the-art hospital. We have a full-service nursing home, the A. Holly Patterson Extended Care Facility, a series of family health centers throughout Long Island, and that there are programs within our hospital from internal medicine to OB and GYN services, cardiology, pulmonary hyperbaric burn center, and I can go on, that are second to none in Nassau County, with some of the highest trained, board-certified doctors and most skilled nursing staff of any hospital in Nassau County. Yet people don't understand that. They think of Nassau University Medical Center as that county hospital. Well, we're not. Now we're that University Medical Center, and we're here to provide full service care to everyone, making us a leading provider of primary and tertiary care centers that rival the best in the country. So I'm glad you guys listened in this morning. We really are a great guest today, Dr. David Eng from the Nassau University Medical Center. He's from the Department of Emergency Medicine, and we're going to talk about some emergency medicine stuff at the hospital, as well as some of the training that goes on and some other issues that I think that you guys really would like to know about, and it should be an interesting half hour. So, Dave, good morning, and thank you very, very much for being here today on Health Talk. Why don't you start off by telling us a little bit about yourself, where you're from, where you went to school, that type of thing.
Well, thanks for having me on your show today, Dr. Politi, on your Health Talk show. Yep. My name is Dr. David Eng. I grew up in Queens. I guess that makes me a disgruntled Mets fan, okay, but I have high hopes for this season. I went to school at NYU, and I also went to Georgetown for a master's degree. I completed my medical training at New York Medical College, and I completed my residency in emergency medicine. I'm board certified in emergency medicine, and I serve as the associate director of our emergency department at Nassau University Medical Center.
Wow, it's great. It's great training, some great background. I'm sort of a Mets fan myself, so we'll see how that works out this year, right? Well, of course, you always have the Yankees we could rely on in a pinch, but
That's right.
We'll see how it plays out. But again, Yankees and Mets fans, so it was two different groups, So tell us about the emergency department. What does that mean, emergency medicine? People, they know that's there, they know they go in an emergency, but there's a whole specialty, a special area of medicine that deals just in emergency medicine. So why don't you tell me a little bit about what the field of emergency medicine is?
It's actually one of the newest specialties in medicine, and basically we take care of all patients that come to the emergency department 24 hours a day for any reason, whether it's you're having a heart attack or a stroke, or if you're having toe pain, or dental pain or tooth pain. So we take care of any symptom that can come into the emergency department. That's what I like about it. That's what keeps it interesting, and I have the privilege of seeing something new every day.
It's definitely an exciting field. And so, Nassau University Medical Center, level 1 trauma, we see adults, we see kids. We have a full peds emergency room?
That's right. We have a pediatric emergency department. We have the main emergency department. We have the psychiatric emergency department also. So we offer a lot of services, and it's a great front door to the hospital. We offer a lot of other services that other hospitals may not offer, like Hyperbaric. We're a bariatric center of excellence. We have all ICUs that you can imagine, the NICU for little babies, the SICU, the PICU for pediatrics. So we offer a lot of services at Nassau University Medical Center.
It's true. People don't realize the extent of basically what we have inside that building and the level of people and the training that people have. I mean, I know just last week we cut the ribbon on our new intensive care unit. So we have a brand spanking new CCU, coronary care unit, brand new MICU, medical intensive care unit, brand new SICU, surgical intensive care unit. So we have three brand new, state-of-the-art, technologically advanced intensive care unit. So, God forbid something happens, you have a heart attack, a stroke, you have a car accident, gunshot, whatever it might be, hitting the head with a piece of an asteroid or meteorite. You come to the hospital by ambulance. You're going to be seen right away, immediately, in one of the level one trauma center, one of the best level one trauma centers in Nassau. You have a trauma room, you have 2 critical care resuscitation rooms in the ER, little operating rooms. Board certified docs get right on top of you. We save your life. If you have to go to the operating room, we have in-house 24 hours a day special surgeons, trauma surgeons that can save your life. Brand new ICU, CCU. So we have that continuum of care that you don't see in maybe an urgent care center or a smaller hospital that doesn't have all of these types of resources. I mean, we even have a CAT scan, a 320 slice CAT scan, not a loaf of bread, 320 slice CAT scan. Why don't you tell us what that does and how that works?
Well, it's an amazing machine. It can actually do what's called a cardiac CT, which we do for some of the inpatient cardiac patients, and it can actually take CAT scan images of your heart and see if there's any blockages. And that's a great tool that we use to look for things like atherosclerosis in your heart. But we use it for a lot for our trauma patients, patients who come in either from a car accident or from penetrating trauma like a stabbing or a gunshot wound. And we use it to look to see if there's any kind of internal injuries.
See some really great pictures of people's injuries, so prevents them from going to the operating room for exploratory surgery. You can actually take some great pictures and see the spleen laceration or the liver laceration, or look at if there's some vessels that were injured after you give some dye. So it really prevents a lot of unnecessary surgeries or complicated surgeries to see if something's happened.
Absolutely, and along with the CAT scan, we also have ultrasound, and it's a great way to look at the bedside to see if there's any bleeding around the liver or the spleen, and it's a great way to take a look inside in addition to the physical exam, and it's an important part of residency training. I learned a lot about doing ultrasound and doing ultrasound imaging at North Shore LIJ, where I did my residency, and I hope to impart that on the residents I may be working with.
So you bring that up, and I understand there's some congratulations in order. You and your program were just approved for a brand new emergency medicine residency program starting this July 1. So why don't you tell us what that entails?
Well, it was a lot of hard work done by our department. Dr. Olson is our program director. He's board certified in toxicology and emergency medicine. And Dr. Booten is our chairman. And there was a lot of work by our department to put the application in. And finally, we were approved. We're very happy to start that residency in emergency medicine. And we look forward to training new residents so they can become emergency medicine physicians.
Sure. How many years is that?
It's a 4-year training program.
So a new doctor just graduates medical school. So you finish 4 years in medical school. That's not it. Yeah, you have to go into a residency program, and residencies have different years. For a surgeon, they have to go 5 years. For an internist, 3 years. So for emergency medicine, it's a 4-year intensive training just in emergency medicine before you even are eligible to take those board exams. Correct?
Correct.
Yeah, and now you're out there. You're a fully certified, board certified ER guy, which we have at Nassau University Medical Center.
That's right. Our physicians are board certified in emergency medicine. They all come from great backgrounds and great training, and we look forward to taking care of our patients.
And what's great, I think, about the hospital is that if you come in with a child, a pediatric, you have a separate area. There's, it's a separate, distinct area from the main ER, so the children aren't intermingled with the adults, and there's no, it's quieter in there. And we actually have board-certified pediatricians in addition to the board-certified emergency medicines that actually see those kids, which really, I think, parents like to know.
That's right. It's a separate area. It's quieter. It's decorated in a peds-friendly environment. Dr. Kumar is our director of the pediatric ED, and we always strive to make kids, especially when they're not feeling well, we want to make sure that they're comfortable. Each room has a television, along with computers and a Wi-Fi network that they can hook up to on their iPad if they want, and it's a great way to kind of allow time to pass while you're waiting for that test maybe to come back, or you're waiting for some additional care.
Right. Yeah, and it's true, and it's a great resource. We take for granted our emergency medical services, our volunteer firemen and our volunteer EMS personnel that are out there volunteering in our communities, as well as probably the best ambulance operation in the country, the Nassau County Police Emergency Ambulance Bureau. The police run the emergency ambulance 911 service throughout the county, and it really is. There's no finer EMS system, and the reason I say that is I know firsthand because in our facility, in our hospital, the medical control. They actually have a medical control at our hospital where all the paramedics, all the ambulances, whether they're from fire department, EAB, or just a volunteer ambulance, can contact the doctors, can speak to you personally on the phone when they call. So if they have an emergency coming into our hospital, they can call medical control. Medical control will call you, and we're able to give some advice to those paramedics on the way in. So you involved with the medical control as well?
Absolutely, it's a part of our daily operations in the emergency department. Not only is it a great way to connect with them over the phone in the field, but they can also give us advance warning if they're bringing us a stroke patient or a trauma patient, so we can be ready when the patient comes to take care of them.
So, for example, I'm coming in with a stroke. I notify NUMC. I'm on the way in. What would you guys do on your side?
Well, one thing that's great about our emergency department is we actually have everything all set up before the patient even arrives. So we have an MR number with a packet of information that we assign to the patient.
Medical record.
That's right, a medical record number that that we go ahead and order things that may be necessary that we anticipate will be necessary in a stroke, for example, like a CAT scan of the brain. So we have that all ready to go, and once the patient comes in, we can expedite their care.
So, strokes coming in, you clear the CAT scan table, so that's available for the patient. You overhead page a stroke team to the emergency department. A neurologist comes directly to the ER. You have a neurosurgeon in the house ready to, guess, God forbid, we have to go to the surgery for a bleed or something in the brain. And so all these things start taking place. And we didn't even start driving to you yet, right? You're ready to take us, and so we hit that door. And that goes for cardiacs and trauma as well, or sick kids. You'll have everybody standing by at the door waiting for you when you hit that door.
Absolutely. We've actually made great strides in trying to improve patient flow and bring patients from the waiting room inside to the ED so that we can take care of them as quickly as possible.
Mm-hmm.
I think it's really unkind to make patients wait for hours in the waiting room, and that's really a story of the past.
Mm-hmm.
And we clearly turned the page at Nassau University Medical Center in the emergency department. We really want to emphasize that we can see patients. We want to see patients as quickly as possible.
Mm-hmm. So if someone walks in the door with chest pain, instant. They're right in the door, right?
That's
They're
right.
on the stretcher. They're in the back. You guys are all over them. Someone comes in with an earache or sore throat. You have a fast track area? What is that? These patients get sent right to the fast track. What is that?
Well, what fast track is for are low acuity patients, and basically their symptomatology is the acuity of their symptoms are on the lower scale. It doesn't mean they're not as important as someone who comes in with a heart attack or a stroke, but we actually placed a nurse in the waiting room area to do a rapid triage, so they can identify these low acuity patients and have them go right into the fast track area. And we actually move the fast track area closer to the waiting room so that so that they can have better access to the patients.
That's great. So you'll come in, you'll see some, a nurse right away. She'll triage you. Then you'll see either a doc or a PA or a nurse practitioner for a pretty minor earache, sore throat. You get seen, get your prescription, and be discharged within minutes. I mean, you're right in, right out. I think sort of we see a lot of these urgent care centers opening up in the community, and they're great for these types of little quick walk-in type of stuff. But we have that same thing in the hospital. And if you need something more, if you did injure your wrist and you're an urgent care center and it's broken, well, that's where it ends. With NUMC, with the hospital, you have orthopedic surgeons there. You have specialists in pediatrics there. You have neurologists. You have cardiologists, endocrinologists. So we have, I think, at our facility, all these specialists that are available. So if you do come in with a problem, that not only can we take care of that problem, but we have a subspecialist that can come and see you as well for that particular problem.
Absolutely, we have top-notch orthopedic care
Mm-hmm.
at Nassau University Medical Center, and you're absolutely right. As opposed to an urgent care, if you need extended care, whether it's a subspecialist or something like that, we definitely have that available for our patients at National University Medical Center.
Yeah, or something as simple as a CAT scan or an MRI or a sonogram. We have that available right there 24/7.
Absolutely.
And that's one of the things that I came here to NUMC. I really didn't really realize the things like you mentioned. Dr. Rotolo and his total orthopedic group. I mean, it's one of the top orthopedic groups in Nassau County are in that hospital, and 24 hours a day there's an orthopedic surgeon available. Plastic surgeon. I'm sure you're an excellent suturer. You can suture with the best of them. But in National University Medical Center, we have the Long Island Plastic Surgical Group, one of the most premier plastic surgical groups in Long Island. And let me tell you, Long Island is a pretty tough place to be good at. And these guys are the best. And again, they're in our hospital. So we have these specialists that are available to treat these patients. And people really didn't. I had growing up in Nassau, living in Nassau myself with my children, I had no idea that we had all the available services that we do have in that emergency department. So, it really is great. And the emergency medical service guys that we talked about before, they know that. And that's why, they're constantly bringing patients over to NUMC because they're telling people, listen, this is where you want to go for your heart. This is where you want to go for your stroke. This is where you want to go for your fracture or other types of things, because the EMS guys know what we're about. But there's that, perception out there in the community that, hey, I was there 20 years ago when it was Meadowbrook Hospital, and I didn't like it. Well, it's really changed. The National University Medical Center of today is totally a different medical center than it was just several years ago, and daily it's improving as well. And your department is leading the charge.
Yeah, I have a great deal of respect for EMS and fire department, police officers. They're really on the front lines, taking care of people, trying to help people, whether it's day or night. And they're constantly bringing patients to National University Medical Center, and we strive to provide the greatest care possible for anyone that walks through the door.
I understand you're involved with the volunteers as well with some of the fire departments. What do you do over there?
I am. I was recently selected to be the medical director of the Williston Park Fire Department and Emergency Rescue Squad. It's a great organization. I love working with the volunteers. And they do a great job serving the community of Williston Park and East Williston and Albertson, and it's my honor to be part of that organization.
We have quite a few doctors at NUMC in the emergency department. They're all ER docs, and they're very involved in a lot of the departments. I myself with the medical director for the Belmore Fire Department and for the Belmore Merrick EMS ambulance organization in Belmore Merrick. And so I try to stay active teaching those volunteers and staying on top of that, medicine with them. But I know Dr. Singh, Dr. Bhutan, Dr. Kumar, all these guys are very involved with the communities, very involved with the volunteer ambulance corps in the communities that they live, and we reach out to these guys. As a matter of fact, we even have in our facility, besides the medical control where they talk to the ambulances, the major training center, the Fire Police Academy, is also in our building. And that's where the training goes on for the volunteers. So if you're a volunteer in the Belmore Fire Department, want to become an EMT, or you want to become a paramedic, we have that training there. And so the volunteers are getting a firsthand knowledge of what NUMC is about when they go through that training. And they train, I would say, several hundred students a year at least through that process.
Yeah, there's an excellent paramedic program on our campus. And the emergency department physicians provide lectures to their paramedic program. It's a great way to interact with them, and then they graduate, and then you see them working in the emergency department, bringing patients to our department. So it's a great relationship.
Yeah, and it's good because it gives them a firsthand knowledge of the ER. They actually rotate. I guess one of the things the paramedics do and the EMTs do in their training is they spend a day or two in the ER with you guys to see exactly what goes on. So when they deliver patients, they have a smoother flow, a little continuity when they drop off patients at the ER, which really comes in handy. So, how about we hear a lot about Ebola. We hear a lot about some of these infectious diseases. What's NUMC doing about being prepared for something like Ebola?
Well, we created a infectious disease unit. Could be used for Ebola. Could be used for another infectious disease. It's a negative pressure room. Certain diseases are airborne diseases, so you have to be prepared for that. And then we have training. We're providing training to our staff about how to put on and take off the protective equipment to make sure that our staff remains safe. And we're prepared. We're prepared to take care of any patient that walks through that door.
Yeah, I know you guys took the lead even back in the summer before the first Ebola case when they were suspecting that this was going on over in West Africa, that you guys started training. We're on the forefront of training all the EMS providers at Nassau. You were giving classes every week, attended by 200 EMS people at a shot, for Ebola and preparation. And again, you said not just Ebola, but any type of contagious disease, whether it's tuberculosis, Ebola, anthrax, sarin gas. So you guys were giving that whole hazmat preparation for all of the county EMS workers, and you were prepared. And now, I believe you took the first or the ground floor, the old emergency department down on the ground floor, and you have some, big giant showers that people can use if they have chemicals on them. And then you have negative pressure, which are rooms that basically take out the ambient air and filter it so it doesn't get blown back into the hospital. And you have rooms where you could don the suits. And removing the suits, they call it doffing the suits.
That's right.
Yeah, and
there's a separate entrance for ambulance to bring these patients, and we have a protocol in place to streamline the entire process.
Yeah, this way you don't mix any of those potentially contagious patients with other patients, so it's
Absolutely.
a completely separate area. And you also have a separate psych ER, and what's that about?
We interact with the psych ED a lot. A lot of patients may have some psychiatric illnesses as well as medical illnesses. So we maybe they have a separate area that patients may go after they get triaged by us and medically cleared to get any kind of psychiatric help they may need.
So we have 24 hours a day, 7 days a week, actual psychiatrists in the emergency department seeing patients that might be having some sort of psychological issues.
That's right, and it's a great relationship that we have with them because there are a lot of patients with not only medical conditions, but they also have psychiatric conditions also that need care.
Yeah, I mean, a lot of times families are at wit's end. They have a child or they have someone maybe suicidal, maybe very depressed. It's the middle of the night. It's late in the evening or early in the morning, and you don't know what to do. And we are there for them. We have that. We have psychiatrists standing by for those patients, and there's no wait. They come in, they see the medical doctor just to make sure it's not a medical issue. Is the person's sugar, blood glucose too low, and that's why they're having these types of, acting the way they are, or they're having some sort of other medical issue that might be, thought of a psychiatric, but it really was a medical problem. And then you have that special area downstairs. It's a psychiatric emergency department with board-certified psychiatrists that'll see these patients right away. So, I mean, another great service that a lot of hospitals don't have. And what's the hyperbaric? It looks like there's a little submarine up on the second floor. What is that?
It's it's a form of treatment that we can use for certain diseases like carbon monoxide poisoning, and it's basically giving patients a higher level of oxygen for treatment. A lot of hyperbaric treatments are used for like diabetic foot wounds. But from an emergency medicine standpoint, something like carbon monoxide poisoning, which can happen in the wintertime, and it's a odorless gas, which makes it so dangerous. And we can use that along with oxygen to treat these patients.
So firemen and police officers involved in fighting fires, or people that are in their homes using gas burners or one of these kerosene lamps, which they're never ever supposed to use, or people with generators, right? And they put the generator too close to the home, and all those fumes from that gasoline, is carbon monoxide, and you could die from carbon monoxide poisoning. So you'll see them in the ER, and when I say submarine, it actually looks like a little small Jules Verne voyage to the bottom of the sea submarine that you could fit up to 6 firemen or 6 patients in there at one time, and you quote-unquote dive them under pressure to get that oxygen into their system to dislodge the carbon monoxide and put oxygen in it. I know a lot of divers, DAN, Dive Alert Network, and scuba divers, and they have the issues with diving, and they get the bends and nitrogen narcosis. I know you guys are a DAN center. You get the divers as well that go in there. You could put them in the hyperbaric chamber for that as well.
Absolutely. Yeah, I've actually participated in some of the diving treatments, and it is like a large submarine that you go into, and they lock the door and you feel your ears pop when the pressure goes up. And not every hospital has this, and we have this in our hospital at Nassau University Medical Center, and it's a great service. We're close to the beach. Sometimes you might get injuries. Or like I said, during the wintertime of carbon monoxide poisoning, we had an experience with Hurricane Sandy, where a lot of families trying to heat their home, they brought in maybe like a barbecue setup or something, or a generator that was maybe put inside the garage or something like that, and all the fumes came in, and they came in for carbon monoxide poisoning. So it was nice that we had not only the emergency department there, but the hyperbaric chamber to treat these patients.
I think it's the only one on Long Island. The only other large multi-place hyperbaric chamber that I know of is up in the Bronx at Jacoby Hospital. So you guys are one of the only ones that have that. And you have two heliports, not just one, two heliports where you could bring helicopters in. And I know sometimes if there's injuries or illness on a cruise ship, but the Nassau County Police Department helicopters will actually pick up those patients off a ship or a boat or a beach and bring them right to you just for that special treatment as well. So
Yeah, it's a great sight watching the helicopter land, and it's something that never gets old for me. I always enjoy watching that and seeing them bring patients over, and us having the privilege of helping them.
Yep, and the burn center as well. I mean, we have the burn center here in Nassau County, the Firefighters Burn Center, which is all redone and has all private state-of-the-art rooms and hydrotherapy for anybody who has any burns. And again, it's a specialty area that we have at that hospital. In addition to all the regular stuff that we have, our primary care center. When I know the ER is on the first floor, and right next to you, we're building this giant area of the hospital. That's a big hospital. It's a big footprint in that hospital, and we're making the primary care center. It's going to be about $20-something million of clinic type space or primary care space for medicine, pediatrics, and obstetrics. Beautiful rooms, state-of-the-art labs, really nicely done for the patients to come in and be treated for whatever they might be. Sort of like a private doctor's office.
It's really a patient-friendly environment. It's on the first floor. You come in right through the front door. There's even a Walgreens right across from that primary care center. So you can go there, get your primary medical care, and then pick up your prescription at Walgreens, which is in the building. How much
More convenient.
yeah, how much more convenient can it get?
Yeah.
So and we also have a way to e-prescribe that in our electronic medical record. So it's a way for us to send the prescription there directly. So there's no longer, perhaps after you see our doctors, we can e-prescribe that prescription, and then by the time you get to the pharmacy, it's available for you. So we're trying. Yeah, that's right.
And nobody wants to wait anymore. Everything's got to be very quick.
I know, in the age of Twitter and Facebook, instant messaging, everyone's got to have their stuff now.
And so, yeah, that's great. So you come out right there in the hospital. We have a full-service Walgreens, which is great, as well as a bank next door, Bethpage Bank, in case you needed to make a cash withdrawal for some reason. But that's in there as well. So, I mean, we're doing amazing things at that hospital. A new eye center with a Cheapers Peepers in there, with full board-certified ophthalmologists. We have about 15 rooms, all fully equipped for eye care. If something happens to your eyes, God forbid, we're there for it. Full physical therapy. Our PM&R, physical medicine rehab, has won national awards, U.S. News and World Report. Great services, great care from those doctors as well. So it really is an amazing hospital. Once you look past the emergency department, and the emergency department is second to none in being one of the finest emergency departments in the county. So whether you come by helicopter, ambulance, or car, we're here for you, and we have just about everything. So we're almost winding up right now. Dr. Eng, I know I want to talk to you about so many other things, but you really are really a great guest, and you have so much information. We didn't even go into some of the new IT stuff that I wanted to talk to you about, but you're doing some amazing stuff with that as well at the hospital. So I'm Dr. Victor Politi, the President and CEO of Nassau University Medical Center. I want to thank you all for listening today, and hope you found this as enjoying and educational as I did. Just wishing you the best of health. Remember, we're here for you at all times. Dr. Eng, I thank you very much for being here today, and appreciate all the time you spent with us.
Thank you for having me. It was my pleasure.
Thank you.